One of the frequently asked questions is about sealants and when should they be placed. I guess the question that maybe should be asked is, number one, should sealants be placed? And number two, what are you doing with a sealant? Are you sealing in decay or are you sealing out decay? And that's one of the myths that I've really tried to dispel over the years, because again, working with microscopes, working with magnification, and also working with real close-up photography, I have seen where teeth that I believed had almost minimally to no decay on them, where they had some early decay that was very detectable, almost undetectable normally through normal routine checking and visiting, but virtually undetectable. And when you go in there, you realize that there's decay in there. So had I sealed in that decay, and if the sealant were if the integrity of the sealant were to hold over time, in theory, the decay shouldn't grow. But why would you want to seal in decay when you really should be sealing out decay? The problem with a sealant is that a sealant is designed to slowly wear down and break down. As they slowly wear down and break down over time, because of normal chewing and everything, the enamel is the hardest substance in your body. Sealant is a plastic material. It's going to wear. So as it wears, it's going to start breaking down, and microscopically, you're going to get more bacteria growing underneath the sealant, and you're going to find that the decay, that small little area of decay, tends to grow, and usually not detectable until you can find it on the x-ray. And sometimes it gets to the point to where that decay can grow to the point to where, heaven forbid, you might need a root canal, and that has happened. So the way I approach sealants is that in my office is not so much about sealants, but the question is, should they be sealed? What's better? What's a better alternative than a sealant? And what I believe the best alternative in a sealant is basically what I call preventive filling. And the idea with that is you address the decay early, you clean out the decay, you clean out the groove, you take care of the early decay without anesthesia, with microscopes, and you restore that tooth with a filling. You don't use sealant material, you can start with a conservative filling, and really, from an integrity standpoint, that's going to last longer. There's going to be less maintenance with that, and overall it's going to be a lot better service for the patient, and in the long run it's going to be much more affordable, and from a cost standpoint it's going to cost a lot less, because you're not redoing the sealants every 2 to 3 years, and you're not worried about possibly the decay growing underneath those sealants, which happens quite frequently. If you like this information, and if you're interested and would like to learn more about our services and what we have to offer, and even more about our office, you should really visit us on www.drheringer.com.